Are you struggling to understand the branches of subclavian artery? Well, in this video, we're going to discuss anatomy of subclavian artery. We're going to pay much attention on its branches, but most importantly, we're going to make it easy to remember for exam and clinical use. What's up, ladies and gentlemen? Welcome back to NeuroSketch with Dr. Kenny. But if this is the first time you've seen this channel, don't forget to subscribe. We're going to discuss about subclavian artery, and the word subclavian is coming from two words. Sub means below or under, and artery and clavian means clavicle. So the subclavian artery is just an artery that is below the clavicle, and our session is done, right? No, we have a lot of things to discuss about subclavian artery. Okay, so subclavian artery is the primary source of blood to the upper limbs. If at all the blood is going to the upper limb, is by way of the subclavian artery. But we'll see it is not limited to upper limbs. It also gives some branches that are going to supply the structures within the neck and also the brain. The posterior part of the brain receive some branches that are coming directly from the subclavian artery, so direct from the subclavian artery. What are the origins of the subclavian artery? Remind me again. Where on the right side we said we have two subclavian arteries, one on the right side and one on the left side, but they have different origins. On the right side, the subclavian artery is coming from the brachiocephalic trunk. Remember, we said we have a trunk here, which is called the brachiocephalic trunk. And because it's brachiocephalic, it has got the brachial part and the cephalic part. Remember, the brachial part, we say the brachial part of the brachiocephalic trunk, it is that subclavian artery. Right subclavian artery is the branch from the brachiocephalic trunk. But on the other side, on the left side, the left subclavian artery is coming directly from aortic arch, from arch of aorta. So the arch of aorta is giving the brachiocephalic artery and the common carotid artery, the left common carotid artery and the left subclavian artery. But the right subclavian artery is coming from, as we've said, is coming from the brachiocephalic trunk, but where exactly? Just behind the sternocostal joint. Just behind the right sternocostal joint is where we have branching of the right subclavian artery from the brachiocephalic trunk. Why is it called the brachiocephalic trunk? Okay, the brachiocephalic trunk is also called innominate artery. Innominate artery. Why innominate? Because it was believed that this artery has got no name. It was believed that in ancient, time there was believed that this artery has got no name and it's called innominate artery. So if I told you find an exam or somewhere the artery is labeled as innominate, it means it doesn't have a name, and this is the special name. Not having a name is a special name for a brachiocephalic trunk. It's a special name for the brachiocephalic trunk. All right, we have seen the brachiocephalic trunk is a branch from aortic arch. Also, the left subclavian artery is a branch of is a direct branch. Don't forget, the left subclavian artery is a direct branch from aortic arch, and the other branch from aortic arch is the left common carotid artery. So the subclavian artery, once it's formed, it is on either side. Once it's formed, it is causing laterally. It's going laterally. To supply. Remember, the purpose of having these subclavian arteries is to supply the upper limbs, right? So it's causing laterally to go to supply the upper limbs. As it goes laterally, is passing through the superior thoracic aperture. Remember, and we said because it's an artery, the superior thoracic aperture is acting as thoracic outlet for arteries and nerves, and some nerves that are coming from the thorax. And artery that is coming there is the subclavian artery. This is the subclavian artery. All right. Remember, we discussed the anatomy of the first rib, and we said that the first rib is atypical, and it's atypical because number one, the head, and number two is the superior surface. The superior surface has got impressions for different structures, but we said we have an elevation here which is called the tubercle, but it's called the scalene tubercle on the first rib. The scalene tubercle. Why? Because the anterior scalene muscle or the anterior scaleneus is going to attach there. It's going to take its to insert in the scalene tubercle. But as a result, what is so important about it today is that the scalene tubercle will demarcate two important grooves. We see we have two grooves which are transversely located on the first rib, on the superior surface of the first rib, and this one, the posterior one, like we have a scalene tubercle, and just behind the scalene tubercle we have a groove for subclavian artery, and you can see the subclavian artery is just passing behind the anterior scaleneus. Just behind the anterior scalenus, we have the groove for subclavian artery, and we can see the subclavian artery is passing. But also we have a groove on anterior surface anterior to the scalene tubercle, which is called the groove for subclavian artery. So the subclavian artery will pass anterior to the scalene, anterior to the anterior scalenus, but the subclavian artery will pass behind the anterior scalenus muscle. So in turn, we see that because we are talking about the subclavian artery is between the anterior scalenus and the middle scalenus. Between the anterior and the middle scalenus, we have a subclavian artery, and this is very important relationship to remember. It's a very important relationship to remember. That's how it causes. It comes all the way from whatever. If on the right side it's coming from the brachial plexus, but if it's on the left side is coming from directly from the aortic arch, but it is causing laterally and is going to be passing above the upper rib, the first rib, and we have impressions for the first rib for these subclavian arteries, and the subclavian artery is passing between anterior scalenus and the middle scalenus, anterior and the middle scalenus. As a result, there are this is that important relationship I was talking about. Like we have the anterior scalenus, and the artery is just behind the anterior scalenus, and in front of anterior scalenus we have the subclavian vein. So vein anterior and artery posteriorly, just behind the scalenus, the anterior scalenus muscle. In turn, the anterior scalenus muscle is demarcating the subclavian artery. Again, the subclavian artery behind the muscle, and the subclavian vein are before the muscle, which is anterior to the muscle. Also here, this is the right side, this is the left side. Again, we have the scalene anterior scalenus, and also demarcating the the artery behind and the vein anterior of before this muscle. Also, you can see also we have some parts of the brachial plexus that are accompanying this subclavian artery. We also have the brachial part of the brachial plexus that is accompanying this muscle, this artery. And so if we have compression, if we have spasm of these muscles, you see we can have compression of artery, but also you can have compression of the brachial part of the brachial plexus, like the banks, the trunks of the brachial plexus that are related to the subclavian artery. So this is a very, very important relationship to remember. Very, very important relationship to remember as they are passing through the superior thoracic aperture or the thoracic outlet. All right. So the scalenus muscle, the anterior scalenus muscle, will divide the subclavian artery into three parts. Remember, we have already seen that the axillary artery being divided by the muscle. That muscle was pectoralis minor, right? But today we'll see the subclavian artery is being divided by scalenus muscle, the anterior scalenus, into three parts. Sorry. Oh, I meant this to be the third part. All right. So the part is divided by the scalenus muscle into three parts, and the first part, second part, and the third part. The first part of the subclavian artery is from the origin, and for example, if we are talking on the right side, we say the right side is originating from the brachial plexus just behind the sternocostal joint. So from the origin of the subclavian artery to the medial border of the anterior scalenus, that's the first part of subclavian artery. The first part of subclavian artery is spanning from the origin of the subclavian artery all the way to the medial border of anterior scalenus. What do you think about the second part? Well, it's okay. The second part is just behind the anterior scalenus. You will forgive me about this one. I meant to be I meant this to write to be the third part here. So the second part is just behind the anterior scalenus, and then the third part is lateral. Just from the lateral border of the anterior scalenus all the way to the lateral border of the first rib. So it's spanning from the lateral border of anterior scalenus to the lateral border of the first rib. And remember, after the lateral border of the first rib, the subclavian artery changes its name to axillary artery. The subclavian artery, once it crosses the lower border of the first rib, it becomes an axillary artery. There is nothing like really structural to demarcate these arteries, but it's just demarcation. They are just being demarcated by the lower border of the rib. After the lower border of the rib, the subclavian artery becomes an axillary artery, and it gives a lot of branches that we have already discussed, or we shall discuss. We're going to put the links downside. All right, so this is the subclavian artery. We have seen the three parts of the subclavian artery that are being divided by which muscle? Yes, anterior scalenus muscle. Well, we have branches of subclavian artery, and the branches of subclavian artery they correspond to the part of the subclavian artery. That you have the first part, you see the branches from the first part, and then we're gonna see the branches from the second and third part consequently. All right, from the first part of subclavian artery, you have which is medial to the anterior scalenus, medial to the medial border of the anterior scalenus. The very first part that you can see this artery, which is now called the vertebral artery. Remember, when we are discussing anatomy of the cervical vertebra, we have seen that the cervical vertebra have got transversal, foramina transversarium, right? And we say the foramina transversarium will transmit the vertebral arteries, and we say the vertebral artery is a branch from the first part of subclavian artery. Now, today we'll see this is the subclavian artery, and the very first part of subclavian artery will have the vertebral artery. The vertebral artery is the very first branch from the first part of subclavian artery, and it is causing is traveling on to the through the spinal, the transverse foramina, and they are going to supply the brain that we have seen. They're supplying the spinal cord in the brain, and we shall see them. We'll have a certain separate discussion on anatomy of the vertebral artery. The second branch is called the thyrocervical trunk, or the thyrocervical trunk. The thyrocervical trunk is coming also from the first part of subclavian artery. And we also have an artery which is descending downside here. What do you think could it be? We discussed about it, and that is the internal mammary artery, the famous internal thoracic artery, which is also called internal mammary artery. We have already discussed about it. I'm going to put the link downside for you to recall, But let's see the vertebral artery again and again. We've said this is the brachiocephalic trunk, just behind the first sternocostal joint. The sternoclavicular. Did I say sternocostal? No, I meant sternoclavicular joint. Sorry. If I said sternocostal, I am so sorry. Sternoclavicular joint. Just behind the right sternoclavicular joint, the joint between the sternum and the clavicle, we have branching. We have the right sternocostal joint, right sternoclavicular joint. Will have a branching of brachiocephalic artery into the right subclavian artery and the right common carotid artery. So this is the right subclavian artery. This is on the right side, and we see one of the branches, the very first branch from the first part of subclavian artery is the vertebral artery, and we see the vertebral artery will go through the transversarium, foramina transversarium. But most importantly, remember, it almost always skips the seventh cervical vertebra. It doesn't go through the transverse foramina of the seventh cervical vertebra. It starts from the sixth all the way to the first one, and then after first one, we said we'll have a group of vertebral artery here on the C1 vertebra on apertures, and the vertebral artery now causes medially is going to join the contralateral. We have two vertebral arteries, one on the right, one on the left, and so once they're passing through the transversarium foramina transversarium, they are going to join together to form one artery here, which we call the basilar artery. Don't worry about the basilar artery. We're going to discuss it when we do anatomy of the brain. But also, this artery is going to supply the posterior part of the brain. The basilar artery is going to supply the posterior part of the brain, and it's very, very important. If you have, troubles with the basilar artery, your posterior part of the brain can go ischemic, can undergo ischemic changes. This is a vertebral artery. It passes from C6 all the way to C1. It almost always skips C7, but in minority of situation you might find it transmits also the subclavian artery. But yes, that's a very anatomical difference. And then we haven't discussed, we don't know anything about the thyrocervical trunk. The thyrocervical trunk, this branch, is also a branch from the second part of subclavian artery. I mean, this first part of subclavian artery. We've already seen the vertebral artery as it goes, but this the thyrocervical trunk is also called, is coming from, pay much attention to the word, like the thyrocervical. So it has got a branch that is going to the thyroid, and because this is the thyroid and this artery is supplying the inferior part of the thyroid, this artery is called the inferior thyroid artery. The inferior thyroid artery, the very first branch from the thyrocervical trunk, from the thyrocervical trunk. But you see thyrocervical means it has got the cervical branches, right? So this artery here is called an anterior cervical trunk. But what is so much important to note is that the inferior thyroid artery, it almost always travels, it's almost always related to the recurrent laryngeal nerve on either side, on the right side and the left side. See, we have a vagus nerve here which is traveling, and said on the right side the vagus nerve sends a branch that is looped around the right subclavian artery. Remember, it loops around the right subclavian artery, and then this artery is called the recurrent laryngeal nerve. The recurrent laryngeal nerve is going to the vocal box. We're going to discuss about the vocal box at some point. But what is so important here is that you have a very beautiful relationship between the inferior thyroid artery and the recurrent laryngeal nerve. And inferior thyroid recurrent, this is very important, and it's very it's of clinical note, because at some point when they want to chop off the thyroid gland, different pathologies of the thyroid gland, they want to clamp this inferior thyroid artery. So at some point they might cut the recurrent laryngeal nerve without knowing, because they are very, very closely related here. So when someone is approaching the inferior thyroid artery, they might accidentally cut the recurrent laryngeal nerve, and we see the patient will present with hoarseness. Don't worry about the hoarseness. We're going to discuss about the hoarseness at some point, but this is of a clinical note. The inferior thyroid artery related to recurrent laryngeal nerve on either side. We have inferior thyroid artery on the right side. We also have inferior thyroid artery on the left side, and they're related to the recurrent laryngeal nerve. All right. And then we go to say the thyrocervical trunk is about the thyroid part, which is this artery, and then the cervical part, we have artery like this one is called the ascending cervical artery, but also we have another artery here which is called the transverse. It's causing, listen, this is artery of the cervical, the neck region, one of which is going is ascending. This is why it's called ascending cervical artery, but one of which is traveling almost transverse, and it's called transverse cervical artery, the transverse cervical artery. We also have another branch here which is called the suprascapular nerve, suprascapular artery. The suprascapular artery is causing in this direction, and these two arteries, the transverse cervical artery and the suprascapular artery, they also cross the brachial plexus. See here, this is the brachial plexus, and these two arteries, they cross the brachial plexus. But the suprascapular artery is crossing the brachial plexus, is crossing across the brachial plexus, but it is going to join. It's going to join the suprascapular nerve. Remember the suprascapular nerve. These two structures will go to supply the muscle. They are going to the suprascapular fossa. Remember the suprascapular fossa, because the suprascapular nerve was supplying the supraspinatus muscle. So the suprascapular artery and suprascapular nerve, they will go together to the to this region of the scapula. But what is most important is we have a transverse scapular ligament. This transverse scapular ligament which converts the suprascapular notch into a foramen. And so this artery is passing above the foramen, above the transverse ligament of the scapula, and the nerve is passing below the transverse ligament, which means it's passing through the scapular foramen, the scapular scapular foramen. And also these two nerves, these two arteries also, they are also related to this nerve over here, because this is a vagus nerve, this one should be a phrenic nerve. So the transverse cervical artery and the suprascapular artery, they are also related to the phrenic nerve. They are crossing the phrenic nerve. They're also going to cross the the brachial plexus at a different parts. That was that was second branch. That was second branch from the first part of the subclavian artery. We've already seen the vertebral artery, and this is a thyrocervical trunk. Remember, the trunk means big, has got a number of branches, and this is why we have these branches from the second part from the thyrocervical trunk. Also, we have internal mammary artery, internal thoracic artery, but we have already emphasized a lot about the internal mammary artery, internal thoracic artery. I'm gonna put the link downside and make sure you watch the internal thoracic artery or the internal mammary artery. We're not going to discuss about the internal mammary artery today. So we're going to the second part of the subclavian artery. And the second part of the subclavian artery has got only one branch, and that branch is called the costocervical trunk. The costocervical trunk. Remember, costal means something relating to the ribs. Cervical, something relating to the neck. Trunk, something big, or give branches. Big or give branches. So what are the two many branches? What are the two many branches in the costocervical trunk? We have the cervical part. This cervical part is called the deep cervical artery. The deep cervical artery, which is coming from the costocervical trunk. And the other branch is now should be the costal related. Remember, when we're discussing the anatomy of the posterior posterior intercostal arteries, we said the first two intercostal spaces, they are not supplied by the descending aorta. We said the first two intercostal spaces that are supplied by a certain artery, which is called the superior intercostal artery. The superior intercostal artery, which is also called the supreme or supreme intercostal artery. The supreme intercostal artery, we said, is a branch of the costocervical trunk, and I told you not to worry because we're going to discuss about it. And today we are seeing this, the superior intercostal artery, which is also called the supreme intercostal artery, is a branch from the costocervical trunk, the one among the branches of the costocervical trunk. And then we have another artery which is very variable. We have an artery here which is called dorsoscapular artery. The dorsoscapular artery will run with dorsoscapular nerve to supply which muscles? Remember, the muscles are supplied by the dorsoscapular nerve and arteries. Remember, we have the levator scapulae, and we have lomboids major and minor, right? So this is very variable. The dorsoscapular artery is very variable. It can come from the second. It can come from directly from the branch of. It can come directly from as a branch of subclavian artery, but it can also be a branch from the thyrocervical trunk. What's so surprising today is that the third part of the subclavian artery has got no branch, and this is good news for you, right? It has got no branches or nothing to mention from the third part of the subclavian artery. So in turn, you have the subclavian artery should have 4 or 5 branches depending on the origin of the dorsoscapular nerve. So the dorsoscapular artery can come directly from the subclavian artery, but can also be a branch from a certain branch of the subclavian artery. Remember, we discussed about the thoracic outlet syndrome. We said because we have the thoracic outlet somewhere here, and the subclavian artery is causing laterally and above the first rib, and it can be compressed at some point. And we said compression of neurovascular structures that are passing through the thoracic outlet, it will result in thoracic outlet syndrome. Now, we didn't mention, but we have different types of the subclavian of the thoracic outlet syndrome depending on the structure compressed. For example, because today we're talking about the subclavian artery, so the subclavian artery can be compressed here, and it give rise into the arterial kind of thoracic outlet syndrome, like arterial type of the thoracic outlet syndrome. Why? Because the arterial, the subclavian artery is compressed, and the subclavian artery is passing through between the anterior scalenus and the medial scalenus. A spasm of the scalenus muscle can result into compression of the the subclavian artery, resulting into thoracic outlet syndrome. We say the clinical presentation will be a pain and swelling of this limb, but also because we've seen that the subclavian artery is also related to the part of the brachial plexus, This compression can also affect the brachial plexus and limit the motion, like the function of the upper limb can also be impaired. Well, we have something very strange, something very strange that is called the subclavian steel syndrome. Subclavian steel syndrome. Remember, we have said that subclavian artery give rise into vertebral arteries on either side, right vertebral artery and the left vertebral artery, and the left and right vertebral artery are going to join to form the basilar artery. The basilar artery is going to supply the brain through the cycle of Willis. Don't worry about the cycle of Willis at this point. What is so important is, if you have obstruction of subclavian artery before it gives the rise for vertebral artery, if you have obstruction of subclavian artery before it gives the vertebral artery, what happens is distal to the obstruction, somewhere distal to the obstruction, the pressure falls down, the pressure goes down, and because the pressure goes down, the blood is coming from the brain, from the cycle of Willis, from the brain into these subclavian arteries to supply the upper limb. Why? Because we have obstruction here, and here we have low pressure, and so the blood will move from high pressure system to the low pressure system to supply. This is very strange. Like the blood is coming from the brain to supply the limb. What the heck? Because the arm is not as important as at the brain. So this is it, and because they will have a retrograde flow of blood from the brain to the upper limb, which is very strange, we are calling it steal, because we have the stealing, so we are stealing blood from the brain to supply the upper limb, and this is called the subclavian steal syndrome, which is very is very, very strange. And what are the clinical manifestation? Can be dizziness, anything relating to the brain, anything relating to the central nervous system, like because we have deprivation of blood that was going to supply the brain, and then it's going to supply the upper limb. All right, this is what I had for you today. But if you have a question, additional comment, you can always put your thoughts in the comment section. But if this is the first time you've seen this channel, don't forget to subscribe. We have Instagram and TikTok account where we usually post related content, and don't forget to swing by. All right, see you really soon.